A few months ago, the lovely woman who was battling cancer came into the studio with her doctor, and they told us about this new drug, oral chemo, in which it was really interesting and opened our eyes up to this new type of drug, which insurance companies were not covering. It was a cheaper, less expensive, less invasive way to treat chemo. And they were going down to Jefferson City to get the legislators to talk about it. And one of the champions of this bill is John Deal, who sits here now. John, some big news on this oral chemo bill.
No, it really is. And I think this is one of these relatively small things, but really have a big impact on people's lives. And I don't, the champion behind this was really Representative Sheila Salon out of Kansas City, who's been pushing this issue for a couple years. And basically what it does is it puts the cost. Actually, oral chemo is more expensive than the intravenous chemo from a just pure drug cost standpoint. But there are longer-term cost savings because patients don't have to travel and you don't have to have a doctor's visit and all that. So the actual cost of it long-term goes down, but it's treated as a pharmacy benefit. It's actually more expensive than the intravenous chemo.
It's also, if I can ask a question, it's also not as debilitating to the patients.
It can be more targeted toward the particular disease and whatnot. And it's really also, I think, very important as a rural healthcare access issue. And when you're out state and you're in some of these small towns in southern or northern Missouri and you have to drive a couple hours round trip, when you're sick, you get chemo, you're sick, and you've got to get back to your house.
3 times a week and whatever.
Right. So, medical technology is changing, and the law has to evolve with medical technology. So we were able to, this year, bring all the stakeholders together, the patient advocates, the cancer groups, the doctors' organizations, and the insurance companies to try to find a common sense solution to this that makes economic sense for everybody involved, but also gets the patients the treatments they need, and we were able to pull that across the finish line early. So it's a good thing.
So the bill passed the House, passed the Senate?
It did. It passed the Senate. We passed it out of the House yesterday, but I think it's 147 to 6, and it's on it'll be on the governor's desk next week.
And the bill says that insurance companies will be forced to cover oral chemo.
Well, they'll be treated as a parity with intravenous chemo. And there's going to be a copay associated with the increased cost of the oral chemo. So the monthly maximum copay for that is $75. And it was very important, I think, from the patient advocate organizations that cost be kept under $100 a month, because otherwise people start, it's a psychological barrier, and people start breaking up their pills or skipping dosage and whatnot. And that's the fear of oral chemo, is that it's not done necessarily under the supervision of a doctor. You don't know if the patient's actually taking their pills and doing this type of stuff. So we need to make it also where the patient has a financial incentive to do that.
So starting as soon as Governor Nixon signs this bill, assuming he is, right? He has signaled that he wants to sign this bill.
Right. It'll take effect August 28th.
Right, without an emergency clause.
And then if you're a doctor and you decide that oral chemo is a good decision for you, the insurance companies will cover that.
That's correct. That'll be part of the base plan, and it'll be required to be covered in insurance policies in Missouri.
But insurance companies weren't covering this before. This law forces them to cover it.
Well, some were, some weren't.
Right.
Okay, and there were different co-pays. And, it really all depends on what type of policy people had. So when you do put this in the base plan of insurance policies, it does affect the actuarial stuff. But the technology of this new type of treatment's driven the cost down, where it makes sense to mandate it in the individual plans.
Sure. Jane Duker.
Well, I mean, I'm extremely supportive, as someone who is directly impacted by the availability of oral chemo, not me personally, but family. And so I'm extremely supportive of this. I mean, it is sort of interesting that we've got the Missouri legislature who spent most of their time in life bashing Obamacare and talking about how many people have, lost their insurance because of, dumb mandates. And, the Missouri legislature is doing a mandate. So I'm supportive of it. I think it's right. I think it's right for medicine. I think it's right for patients. But, but picking and choosing mandates is kind of interesting. I mean, this is exactly what Obamacare did, and this is exactly what Republicans have saying has ruined insurance and ruined health care. And so, I just want to point that out, that it's good policy, and and they're doing it, and it's good policy, and why don't we just call it what it is, which is a mandate?
I want to respond. I mean, first of all, it's a shame we have to politicize something that everybody agrees on. The difference with Obamacare and what we're doing is whether or not this is a decision made by state governments to govern policies in the state, or whether or not the federal government comes in and dictates policy to everybody else. So, look, this is something we agree on, we work together on. I don't think we need to make a bigger political statement about it.
Jay Kanzler.
I agree with John.
Shocking.
Shocker.
No, but what I want to say, well, again, what I agree with John is we don't have to make a political issue of it right now.
No, only when we're talking about Obamacare do we make it political. Right. I mean, you have to point that out, gentlemen. And since I'm, it's 2-on-1, I get an extra shot.
I do want to make a
But
point
it's federal
here.
versus state.
Yeah.
Oh, okay, that's a line without a distinction when it comes to patients and people.
Listen, I want to talk about it. We sit around these microphones on a weekly basis and bash legislators and legislation, and in many cases, rightfully so. It's very interesting to me as a follower of what goes on in Jeff City to see a lot of the good things. This is a good thing.
A great thing.
There are other good things that are coming out of Jefferson City, including educational funding and other things, and those are coming out of a Republican legislature led in large part by John Deal, and I applaud that.
We can only look forward to them actually working together more next year when he becomes Speaker of the House.
Yes.
Yes. All right. That was Jay Kanzler, John Deal, Jane Duker. It's nice to not politicize something that happens in Jefferson City.
I know. Well, we got to get away from
Jane,
that, right?
why don't you stop politicizing?
I know.
Politicizing the good thing. We can all agree, right?
I know. I like
Just
it.
like we can all agree Obamacare is bad. Why do you want to politicize it?
Right,
Yeah,
exactly.
It's
exactly.
nearly unanimous.
Yeah.
And I supported, and I also supported the autism mandate, which I thought was also exceptional, and it was along the same lines. And,
Right.
So I'm sure there were some plans that may have left Missouri because they didn't want to cover autism treatment.
I just hope I don't get something that isn't mandated.
Right.
Yeah.
The difference being, Jane, when a plan leaves Missouri and doesn't want to offer insurance, I'm not forced to go hop on a website and get my insurance elsewhere.
Well, that's the state's choice. The
Right.
state chose not to set up a
no,
state.
no. I'm talking about I have to, under federal law, buy insurance. If my insurance company left because they didn't want to offer autism care, I could go uninsured previously. Now I
Now
can't.
you can't. That's right.
Except that if you're uninsured
We pay your
and
bills
you get
anyway
sick, the hospital is forced
to cover you.
to cover you. If you don't want to buy a hamburger, I'm not forced to buy your hamburger.
Right. That's the difference.
Right. I have no problem. If you want to be uninsured, sign a little waiver saying you're on your own when you get sick. I
Right.
don't have a problem with that.
Exactly.
But we are forced to treat
Cover people, right.
who are sick. So you should be forced to buy your own insurance.
I think that's fair.
I think that's a very conservative point of view on my point of view.
Right.
Yeah. Speaking of all of this, ladies and gentlemen, covered by Medicare and covered by most major insurance carriers,